the term neurodivergent is used a lot nowadays, and it is a blanket term. It's sort of a term for things like ADHD and Autism Spectrum Disorder and things like that. But obviously those disorders tend to be rather different. Sometimes a kid with ADHD might have similar difficulties to a kid with autism, where maybe they're having some difficulty with peer interactions, maybe they're having some difficulties regulating their own emotions. But those disorders look very different, and sometimes they have very different ways that someone like me can help treat your child. So a child with ADHD, if they're having some impulsivity and hyperactivity, they just need help like figuring out when to apply the brakes and when to control those impulses versus when they are free to be energetic and active and use that sort of spontaneity as a strength, versus someone with autism is probably going to have very different needs. They're probably going to have some sensory things to explore. And that's where someone like me can come in to help you as their parent figure out the behaviors, the symptoms. Is my child neurodivergent? And if they are, what do I do about that? What do I do with them at home? What should I advocate at their school to help them thrive?